this time. I've been joined by Deputy Secretary Kate Matson from the Department of Health to provide the COVID-19 update for today, Tuesday the 28th of September. So we are reporting 867 newly locally acquired cases from yesterday, and in addition to that, a number of cases from the two previous days. 140 cases which were reportable from the 27th of September and 9 cases which were reportable from the 26th of September. These were due to a software update by a third-party vendor who supported one of our pathology providers. This meant that test results were not reported to the department's central system, but were nonetheless still reported to all of those people whose tests were undertaken, including those positive cases who received their advice as per normal from those pathology providers. That software problem has been rectified by our partners in the pathology contracting area, and this fortunately did not have an impact on either the people concerned getting their test results, particularly the positive cases, and more importantly, the advice from the pathology advisors to both isolate and await further information. These number of cases now bring us to 9,261 active cases of coronavirus in the state. Sadly, I have to report that 4 further people have passed away from COVID over the past 24 hours. A gentleman in his 80s from Whittlesea, a woman in her 80s from Hume, a gentleman in his 70s from Hume, and a woman in her 50s from Whittlesea. Can I take this opportunity to pass on our deepest condolences to the family, friends and communities of those people who have seen their loved ones pass away. We also have 375 people with COVID in hospital at the moment. 81 of those are in intensive care and 61 are on a ventilator. Of the people who were in hospital yesterday, 78% were vaccinated and 17 were partially vaccinated. In regards to tests, 49,450 tests were processed yesterday, bringing us to over a 2.5 million figure since this current outbreak commenced. We also had 35,160 vaccines administered in our state-run hubs and a substantial additional figure through our primary care partners as well. This brings us to, as of yesterday, over 48% of the over 16 population receiving the 2 doses of COVID-19 and approaching 79% for the first dose, which gives us that number to tip over into the 80% single dose trigger for those modest relaxation measures that are due to come in from 11:59 p.m. tonight within the next reporting period. I'm also in a position to advise that today we will be asking a number of those Victorians who are isolating at home at the moment to take part in a pilot program to test, as part of the National Cabinet decisions, the new home quarantine check-in processes, which in this case is an app-based format, which will add to the tools as to how our quarantining system can make sure that people are where they're meant to be and when they're meant to be. This will assist Victorians coming back from both overseas and internationally sooner rather than later as part of the national plan. This app uses a downloaded picture from a smartphone or a selfie just to check in where you are meant to be and when you're meant to be there, and it links back to a location-based technology to confirm both the place you are and your identity at the time of the alert. Participants will receive advice via the smartphone app as to their obligation at random times to provide the selfie back to the public health teams. Should that not be responded to in a period of time, follow-up calls or visits are made so as to make sure that the person is where they should be. The app only uses the selfie and the location at the time that people check in. And as I say, you've got 5 minutes from the alert to provide that advice back. We will continue, of course, at the same time to support people in quarantine at home with all the other supports, whether it be the random checks, the assistance for support, and of course encouraging anyone who needs the financial assistance to safely isolate either whilst they're being tested or whilst they're at home for 14 days to take advantage of that system that gets you the financial and material support to get you through. This is a voluntary pilot, and it's one that's being conducted by a number of states as part of the National Cabinet decision to trial alternatives to hotel quarantining. This will run for 4 weeks. It's open to anyone 18 years or older who's got access to the relevant smartphone technology, and we'll make sure that that rollout of the National Cabinet decision about alternatives to hotel quarantine can be applied as soon as possible. Victorians in home-based quarantine who agree to take part in the trial will have to, of course, isolate at home and get the support during that period of time. The Department of Health will make contact with Victorians who are interested in that process, who are currently in or going into quarantining over that period of time. It will be an easy and less fuss way of making sure that people are all doing the right thing, protecting themselves and protecting the community. I might get Deputy Secretary Matson to take us through some of the more detail behind today's numbers and particularly the focus on areas of concern, and then we're happy to take questions. Thank you.
Thank you, Minister, and good morning. I'll take you through some of the geography of the cases, which is changing a little bit day to day, but of course the focus is still in the northern suburbs of Melbourne. Of the cases we're reporting today, more than 50% are in the northern suburbs, including 270 in Hume, 125 in Whittlesea, 88 in Moreland, 43 in Darebin, and 24 in Banyule. In the west, we had a number of new cases, primarily concentrated as follows: 55 in Melton, 51 in Wyndham, 54 in Brimbank, and 28 in Moonee Valley. Cases are growing also in the southeast. We had 45 cases in Casey, 20 in Port Phillip, and 16 in Greater Dandenong, and we're starting to see case growth in the east of Melbourne. So again, please, if you're in the east of Melbourne, remain vigilant. 14 in Maroondah, 14 in Knox, and 10 in the Yarra Ranges. We're reporting 28 new cases in regional Victoria today, and I'll go through these in a little bit more detail. We have 12 new cases in the Latrobe Valley. We now have 16 total active cases across 3 households in Moe, Morwell and Traralgon. A number of these cases were unfortunately infectious in the community for a number of days, and we're aware of a household gathering that occurred over the weekend. So we have concerns that these case numbers will grow. Please, if you're in any of these areas in the Latrobe Valley, Moe, Morwell, Traralgon, keep an eye on our website. We are posting all the regional exposure sites on our website, and be on high alert for symptoms. At this stage, we are looking at increasing testing capacity in those areas, and we ask if you're experiencing symptoms or have been contacted as a close contact that you do go and get tested. And we ask for those people who aren't experiencing symptoms or haven't been contacted, please hold off as we increase capacity. A rapid response testing unit has been deployed to the Traralgon Basketball Stadium, and more pop-up testing sites will be emerging in the coming days. This is in addition to existing testing sites at Australian Clinical Labs on Grey Street, Traralgon, the Latrobe Respiratory Clinic on Princess Drive, Morwell, and the Moe Senior Citizens Centre on Langford Street. We've got 5 additional cases in Mitchell Shire. 3 are already known close contacts. 1 is believed to be acquired from a workplace in Melbourne, and 1 still under investigation in terms of acquisition source. We have 2 cases in Baw Baw, 2 in Geelong, 1 in Corangamite and 1 in Warrnambool, and those are all existing known close contacts who are in isolation during their infectious period, so there's no increased risk in those communities from those new cases. 1 new case in Horsham, but that's the residential address, and that case has been in Melbourne throughout their infectious period and we believe has acquired the virus in Melbourne. 2 cases in Shepparton, 1 of whom is a known close contact and 1 whose source is under investigation, and 1 in Gannawarra, also with an unclear acquisition source. We also have 1 case in the Macedon Ranges who works in Melbourne. In terms of a couple of outbreak sites of interest, we have an additional construction site in Richmond. It's a large construction site on Bridge Road, and we currently have 11 cases related to that site, but we have a large number of primary close contacts. Up to 250 people were working on that site at any one time. So with other workplace contacts and of course social and household contacts, we're well over 300 primary close contacts. So we do expect case numbers related to that particular outbreak to grow. With respect to the Meadow Heights Aged Care Clinic, or Centre, we now have 29 cases associated with that outbreak. With respect to vaccinations, today we're launching a new pop-up at the Islamic Museum of Australia in Thornbury. We've been working very closely with them over recent weeks, and we thank them for all their work and engagement with community across Melbourne. Thornbury is in the city of Darebin, which I mentioned earlier, and the city of Darebin has the 2nd lowest first dose vaccination rate in the state at this point in time, and 296 active cases, including, as I mentioned, 43 in today's numbers. So Darebin as a high priority, and this site is a high priority and a great addition to the vaccination centres in this area, which includes 2 state clinics in nearby Heidelberg. The pop-up clinic is open to all local residents, but is particularly aimed at members of our Muslim community and has been well promoted by the Islamic Museum and other community groups. There will be culturally appropriate provisions in place, as well as on-site language supports if necessary. So this is just one of the dozens of pop-ups that we've opened recently and will be opening in coming weeks. In terms of other vaccination success stories, the Surf Coast Shire is now the 2nd local government area to pass 95% first dose vaccinations. So in addition to Queenscliff, thank you to those residents of the Surf Coast Shire and congratulations on hitting that terrific milestone. Hume and Whittlesea, in the heart of our northern suburbs, have seen the highest level of first dose growth in the state in the past week, and that increase is extremely pleasing given the number of positive cases in those areas. Hume has grown by 9.3 percentage points and Whittlesea has grown 8.2%, and that's well above the state average. Other outbreak areas that have exceeded the state average growth in the past week include Wyndham, Melton, Dandenong, Mitchell, Cardinia and Casey. So again, I thank all those residents for coming forward for vaccination. As we all know, that is the best way through the other side of this outbreak. And I'll pass back to the Minister for questions.
Thank you, Kate. Happy to take questions.
Would we be able to get the vaccination status of those who have passed away in the past 24 hours?
Yes, as I understand it, at least 3 were unvaccinated. I think we were just waiting on the update of the person in her 50s. So the first 3 were sadly all unvaccinated.
Perfect. And you touched on this before, just about the glitch in that third-party computer system. So you were saying this didn't impact the fact that these people were told that they were positive cases.
That's
it was
right.
just about the overall figure.
That's right.
Okay.
Do we have any detail on where the cases were from?
A range of different areas. I don't know precisely. The contractor has a range of coverage, some industry, some geographic, but we can, if it's available, we'll certainly provide it.
So is it correct then our 867 today is minus the 149 that was caught up in the glitch?
No.
It's on top of?
Yeah, well, the glitch was identified yesterday and was a date stamp issue on the pathology reports, and then how that's reported from the agent, from the pathology partner to the Department of Health system. And because it had an incorrect date stamp on it, it was failed to register on our system at the appropriate time. So today's numbers are accurate for yesterday. The additional numbers of 9 cases from the 26th and 140 cases from the 27th reflect when that error was commenced and then when it was identified and fixed.
So in the past 24 hours there's been 867
Correct.
confirmed cases in Victoria,
Yes.
plus the 149.
Plus those ones that have now been reported to us. They were detected, the people involved were advised, but because of the incorrect date stamp measures that the pathology partner had, they weren't registered on the Department of Health system. That's 149 cases out of over 2.5 million since this current outbreak has commenced of tests. So it's still 149 too many, but it's a small, very small percentage.
Does the department have any checks and balances in place to notice when you happen to have 149 cases missing?
So in terms of how we work with our pathology partners, there's constant revision of their systems built into their contracts, built into their day-to-day liaison with the pathology team, and it was through that process that the pathology partner identified its errors and quickly rectified those with our public health team.
Ms Matson has mentioned about a dozen cases linked to a construction site in Richmond. Construction has been closed for almost 2 weeks. Have they been operating there illegally? Or
No, this predates the closure of the sector. So not from last week, the week before. So that's been on the radar for a couple of days. The contact tracing has run it down, drawn all the links, and it's a substantial number of PCCs on a very big building site.
are we still doing the same, just on contact tracing, are we still doing the same level of thorough contact tracing we were doing a couple of weeks ago? So if a case is identified as positive, do you try and establish all of their connections and where they may have visited?
So there's increasing emphasis on priority sites, such as high-risk settings such as this site, healthcare settings, at-risk communities, those kind of issues. You can't have 9,261 active cases and have the same level of additional support than if you had 900 cases, as we did not that long ago. Having said that, the commitment to making sure that everyone is contacted and that the processes of working out in those rings is still being delivered, but whether they're triaged in importance is that's certainly been the difference.
With Latrobe Valley, you've got 12 cases in Latrobe Valley, and I think you mentioned there was a case that was at a party on the weekend. Are they on the brink of lockdown in the valley?
So it's very serious. This is a part of Victoria that has been pretty well protected from COVID over the course of the last 20 months. There's increased testing going on. There's high level of engagement between the Latrobe Public Health Unit and particularly those communities in Morwell, Traralgon and Moe. Testing underway, work with the cases and their surrounding households is underway. There's no announcement to be made today, but if that situation changes, we'll be certainly back to let the people of the Latrobe Valley know.
What are the details of this gathering? What do you know about it?
I don't know. It was a social gathering of a number of households, and that's regrettable. And as we say on many, many occasions, people don't think it applies to them. People think we're all good. It just takes one case with this highly infectious Delta variant until such time as we've got the levels of vaccination where we want them to be for these kind of outbreaks to occur.
How much evidence are you seeing so far of cases emerging from Saturday night illegal gatherings?
Well, it's too early to tell whether this is one of those cases. I'm not advised, but we foreshadowed that this would be a high-risk environment in which, understandably, people want to share the passion and the enthusiasm of a grand final, but it came at a huge risk. Whether this is a case or not, I'm not advised at this time.
Back on the Richmond construction site, is there any evidence of any of those people having attended the protests in following
Not
days?
that I'm aware of.
And when did the first of those cases emerge? When did the health department first become aware?
Unless case, just over the last few days. And in terms of specifics, we could certainly get that to you.
Cases are obviously still rising. We're almost at 900 daily cases today. In places like Hume, Whittlesea, where the epicentre of the outbreak, first doses has really ramped up, but at second dose levels, they're still below the state average. When do you think we might be able to see cases start dipping again when they get to 50% double dose, for example?
That was the best lived experience we can point to is New South Wales, where that essentially was the case in those high-risk communities. Once they hit over 50, the curve started to bend. It's the same variant, it's the same vaccines. Communities are not dissimilar in a lot of ways. We would certainly be doing everything we possibly can with the support of those communities to get to that level as soon as we possibly can, and then seeing that curve bend.
And at this rate, when do you think they might be able to hit 50% double dose targets?
The first thing to do is to get to those single dose targets, and where, as Kate pointed out, those communities in the north have really stepped up, and in the west have really stepped up. And indeed, we're seeing that at the moment in the southeast as well. The scheduled doses to make sure that we get that first ring of protection, subject to supply, which is looking increasingly where we want it to be. We want to make sure that we get to that dose as soon as we possibly can, given the GPs, the pharmacists and the state-run clinics. That will be over coming weeks.
But just, I guess, based on scheduling and what's already been delivered, do you have a projected date as to when they might start hitting 50% double dose targets?
I'm sure the team do. I don't have it with me at the moment, and if we can provide that to you, we certainly will. There's a schedule arrangement based on the current, and then once we hit the figures we want to be, the shorter dose period.
Speaking of supply, we've heard from the Federal Health Minister this morning that he believes by the end of October, based on what they're sending us, there's enough for everyone over 12 to be double dose vaccinated by the end of October. There will be supply there. Is that your understanding of the numbers coming in?
Well, we still don't have final confirmation of that last week of October. We've got a range, and we welcome the increased certainty for the weeks that we have been provided. We're particularly pleased to see that the largest increase goes to primary healthcare providers. There's a big responsibility on GPs and primary healthcare to step up and deliver in that space, and I'm confident they will. Add to that Moderna and AstraZeneca through our community pharmacy partners. That's really important as well. Victoria's state-run clinics, whilst we welcome the increased certainty for the first 3 weeks, we just need that last week, which goes to Samaya's question about targeting our pop-ups and targeted arrangements in the high-risk communities at the moment. Having said all that, our state-run clinics could do more, and we will continue to work with the Commonwealth to seek more access to more vaccines.
Is that accurate, though, what he's saying, that there will be enough for all of those, for that full cohort to be vaccinated? Is that your understanding around the numbers?
Mr Hunt, the federal government Minister Hunt controls the supply. If he can confirm even more for Victoria across all the weeks of October, then I'm sure that'll be the case.
If that's the case, can we look at bringing back the Pfizer interval from 6 weeks to 3?
We get asked this every time we step up, and the answer hasn't changed. We need to make sure that the vaccine first ring of protection is provided to everyone, and that means as soon as we get to that point of protection, then the scheduling of the second dose might well be able to be brought forward. We're doing a lot of work on that, and we hope that the certainty of supply across all 3 platforms, GPs, pharmacies and state clinics, over October will give us that certainty, which will then allow us to bring that dose back to less than 6 weeks for the mRNA, Pfizer and Moderna vaccines, which should then bring forward that all-important double dose figures of 70 and 80%.
Minister Hunt also announced that at-home rapid testing kits have been approved from November 1, but it's now up to the states whether or not we use these. Will our state government be rolling these out, and how?
Well, we welcome that announcement. Through our processes and representatives of the ATAGI group, we'd been quietly working for that for some time. Rapid antigen testing is already a part of the state's efforts, whether it be in our health settings or in our hotel quarantine settings. It will be an important additional tool in the public health response right across the country for industry settings, for education settings, for all of those groups that are increasingly seeking to require testing to be part of negative tests, to be part of how it is that we get through the gateway of the 2 key pillars of the 70 and 80% double dose, whilst making sure that as people open, they open safely, with rapid antigen testing being an important part of that. It won't replace PCR testing. It will be an important additional tool that will give particularly industry and those wider community settings greater protection.
So is it something that you'll only look at after we reach 80% double?
Oh no, we're already looking at it now, and we'll work with the Commonwealth. I haven't seen the ATAGI guides on all this, and the 1st of November is still some weeks away, but just like the Commonwealth has outsourced quite a lot of its responsibilities to the states over the course of the last 20 months, it doesn't come as a shock that having made this decision, it will ask the states to implement it.
Brendan Murphy basically gave an assurance this morning that you had enough doses. What is the difference between your advice and his advice?
That last week of October.
The Premier also said this morning that anyone who was saying that Victoria wasn't sticking to the national plan hadn't read the national plan.
Yes.
But my understanding is under Phase C at 80%, double-dosed people are meant to be exempt from all domestic restrictions. That's not what's going to happen in Victoria. How can you say that we are sticking to the national plan?
Well, with greatest respect, I think your understanding is no doubt accurate at that general level, but what does that then mean when things are played out in a public health order manner? The Victorian plan is delivering to the dotted I and cross T the general national plan. How it's then applied in each state and in each territory is clearly playing out a little bit different, but Victoria's position is we are delivering the national plan.
But a patron cap's in the spirit of the national plan if double-dosed people are meant to be exempt from domestic restrictions.
No, I don't think that's, with greatest respect, I don't think that's the case. If you go and read the Doherty initial modelling and their subsequent iterations as provided to National Cabinet and published on their website, there is still the talk of social distance measures and other restrictions on mechanisms to make sure that as you get to that 80 double dose, you stay open. It's not just, as the New South Wales Premier yesterday accurately put it, 80% is not some massive freedom day where there are no restrictions. 80% is a significant milestone that eases a lot of gateway restrictions, but it is not the end of the global pandemic. And any suggestion to the contrary, I think, is a misreading of both the Doherty report and the national plan.
The national plan has also made it pretty clear. The national plan has also made it pretty clear that interstate and international travel could be on the cards.
Yes.
Are we able to get any more clarity from the Victorian government about when that could be possible?
As soon as possible. Victoria supports the intent and the direction of that. That's why we're working through things like we announced today, the trial app to make sure that hotel quarantine alternatives are available. That's why we're working very hard with the Commonwealth on the Mickleham facility. That's why we are looking at things like the return of international students through the International Student Plan, which we will submit to the Commonwealth, while we're delivering on the Pacific Islander workforce for the horticulture and agricultural sectors. There's a myriad of really practical steps that will bring different groups to Australia, including Australians who are stranded overseas, and allow international travel. And I think the confidence that Qantas, for instance, had yesterday to start to reschedule flights, particularly in Victoria, is reflecting the hard work that we're doing. When all of that work is landed, we'll have more to say.
If everything goes according to plan, all the measures are put in place that you just mentioned, we hit our 80% double dose target. Are you looking at the 5th of November as a date for when we can reopen to Sydney?
Well, we'll have more to say about that when all that work's done. There's a vast array of moving pieces, not all of them within the Victorian government's control. International borders are still one of the few things that the Commonwealth has yet to figure out how it can outsource to the states. We'll piece all of those together, and when that is done, we'll have more to say.
Increasingly getting closer to our daily case numbers are increasingly getting closer to what Sydney's are, almost on par, I think, in the past 24 hours. There's a definite feeling today that keeping that border closed is no longer relevant. What would you say to that?
Well, as the risk profile changes, that's pretty accurate statement, I think, which is why over the last week or two we've eased the restrictions to bring firstly Victorians home. We've had many thousands of people from red zones come back since that announcement was made last week. The last figure I saw was well and truly over 3,000. We've had all but one person return from that border bubble area, and in the not too distant future we'll have more to say about how people from Greater Sydney can return to Victoria.
Does it make sense to still make those people do 2 weeks of home quarantine, given that they'll have tested negative, they're required to be double vaccinated, they therefore would appear to pose less risk than most Victorians walking around the community?
So you're quite right, Rachel. All of those things are under active consideration as to just what is the risk profile, and then how does that play out in a delivery of an appropriate quarantine system, which at the moment is, as you say, based on the 14-day arrangements. But as the risk profile changes, we would expect from public health that advice as to how to manage that risk will change.
And just on the home quarantine trial, does the fact that we're increasingly going to have people quarantining at home, initially returning from interstate but eventually from overseas, does that mean Mickleham going to be a white elephant before it's even healed?
No, not at all. Again, it's up to the Commonwealth as to which nations are rated different risks, but we could well and truly work on the basis that for some time, some significant time into the future, different nations will pose different levels of COVID risk, and that will also be a factor in who gets to quarantine where. Then in addition to that, you've got a whole range of specialist groups such as the agricultural workers, such as international students, all of whom will have a variety of different vaccines, some of which will be recognised, some of which won't in an Australian context. So Mickleham and its equivalent facilities will, I suspect, be in high demand for quite some time to come.
The Burnett modelling had predicted that we might reach between 1,500 and 3,000 daily cases by October. Is that still what the department's advice is, that we'll get to those figures?
Yes, the projected figures that we are now seeing, I'd refer everyone back to that Burnett modelling. The projected cases that we are seeing is pretty much on call as to where the Burnett modelling said the number of cases and the number of hospitalisations would be. That is within the power of all of us to bend that curve quicker by getting vaccinated as soon as we possibly can. And that range that you hit on, Samaya, is still the prospects of what we're looking at.
And, sorry.
Hang on, I'll keep going around.
Sorry, can I just finish on that? The Burnett modelling also said that its results could be a lot more pessimistic and the real world much better.
Yes.
Because it had assumed that the current epidemic growth rate will continue, which obviously it is, when it's possibly biased by recent infections being concentrated in communities with below average vaccine coverage. Given vaccine coverage has increased and it's almost on par with the state average, do you think it's still a pretty accurate prediction or an accurate projection?
We're not there yet. Yes, I do. But as precisely those ramped up efforts of targeted pop-ups of engagement with high-risk communities, if we can do even more there, subject to supply, then of course we'll be able to bend that down quicker. Hence our announcement yesterday of targeting GPs and pharmacies in those high-risk communities. Why the Islamic Centre pop up today, while schools' sites will be popping up on a regular basis in the north, the west and the southeast in high-risk communities. That is precisely why those areas are being targeted, to make sure that we get ahead of those projections. Having said that, the Burnett modelling has proved to be pretty accurate so far, but is in with all of our power to bend that down quicker and be on the more optimistic side of getting out of this if we not just follow the rules, but get vaccinated as soon as we possibly can. Sorry.
There's been ramping at the Northern Hospital.
Yes.
The union boss on radio this morning just saying that the hospital just may not cope. What are we doing to prevent seeing these scenes?
So firstly, we certainly acknowledge that our paramedics, our emergency department workers, our frontline healthcare workers are working like never before. 2021 baseload work has been extraordinary, whether it's in ESTA for the 000 service, whether it's been in Ambulance Victoria, in EDs, in the hospital wards and in the community. As a result of having seen demand go down in 2020, it has roared back and stayed back in 2021. Add to that, particularly for 000 and particularly for Ambulance Victoria, both suspected COVID cases and actual COVID cases, and the extra measures that the ambulance staff have to take to protect themselves and the wider community and their fellow healthcare workers. We've seen the complexity and the time of how they respond rise to new levels. And if the projected figures that we've seen from the Burnett Institute are in fact what we really are going to see over the next month or two, those levels of demand are only going to increase further, and the levels of stress on our healthcare system are only going to increase further, which is why we have to navigate our way through those gateways of the national plans reopening, but at the same time do that within the guardrails of protecting the fundamentals of our healthcare system. We do not want to be in a position where we deliver the national plan, but in so doing crush our healthcare system. We need to make sure that through that very difficult pathway of both delivering the national plan and protecting our healthcare system, we achieve both goals. And that is through further surge workforce. We've had, as recently as yesterday, a discussion with Ambulance Victoria at a very productive level as to the measures they're taking. Our record investment in the emergency departments, in further work with our frontline healthcare providers in different ways of how, as more cases come into the system, they're dealt with both in the community and in hospitals, are all part of this really delicate manoeuvring that we have to take to get to the other side of this pandemic, but at the same time maintain the integrity of our healthcare system. And I know that our already fatigued frontline healthcare workers, whether they be paramedics, nurses, clinicians, everyone in the system, we need to protect them and supplement them on the way through to achieve those two goals.
Doesn't it show that that the system is already completely buckling? If it wasn't just the Northern, it was Austin Hospital as well last night. Doesn't it show the system is actually already buckling and broken?
The system is under stress, and that stress will continue to grow as cases grow, and those measures of having to protect the workforce and the community through those COVID-safe and suspected COVID cases are being dealt with. That's why we have in place plans to support the workforce, surge and supplement the workforce, and provide different mechanisms to address both suspected and actual COVID cases in the healthcare system. And that means, as I think I've indicated quite readily on a number of occasions, some aspects of how our public health system operates being switched off or deprioritised, and partnering with the private sector increasingly so as to switch demand from the public sector to the private sector.
There were reports on radio this morning that there was a 10-minute delay on the 000 number at times last night. It's been described as the worst it's ever been. Can you explain why that's happening?
I did hear those reports. It goes to those issues of demand, particularly in the north and the west, and as concern and anxiety around COVID and other cases grows, we see that level of demand grow. On top of, as we've indicated already, historically high levels of demand. Put those two together and we've had issues, I'm not exactly sure as to the precise details, but I'm sure that's an accurate reflection. We are seeing unprecedented levels of demand right across our system, and we need to make sure that we do everything we can to get through that. So can I use this as an opportunity to reinforce what's a regular message, that 000 calls are there for the most urgent calls. And if there are other calls, sometimes for quite unusual non-health matters, now is not the time to make them. If you're not in an urgent case, then please call Nurse Online, call your own GP, call other mechanisms to get you through if it's a non-emergency situation. The next few weeks will be extraordinarily challenging for our frontline healthcare services, and anything we can all do to ease that demand pressure on them that is reasonable, then I would urge every Victorian to do so, whilst at the same time we will ramp up all of our efforts to support our frontline healthcare workers in what will be a hugely challenging period ahead for them.
Just on that surge workforce that you mentioned, how do you propose to add to that workforce? Are you calling on healthcare workers whose registrations have lapsed again?
All of those measures that have been floated for some time. For instance, through APRA, we've looked at and have got a degree of support from recently retired medical and other practitioners to come back. There were reports, and Ambulance Victoria have confirmed them, about them looking to other civic and medical partners who can supplement their workforce safely. We've seen mechanisms whereby students and other categories of people who can act as immunisers can replace our frontline clinical staff who are currently at vaccination clinics, for instance. There's a raft of measures that are under not just active consideration, are being implemented now to bring to expand that workforce, but to do it safely so as to get us through this period ahead.
And is there an urgent number that you need, though? Is there a figure of the amount of people that you need?
We'll take anyone who can safely and properly do that work, and that work will vary from service to service and area to area, and our health services, our Ambulance Victoria staff, Esther, for instance, are expanding their recruitment as we speak. All the different parts of the system are stepping up for what they know is going to be a hugely challenging period ahead.
In Darebin, are there particular suburbs that you're most concerned about regarding cases and also low vaccination rates? The southern end of Darebin or the northern end?
I'm sure there are, because you can trace these things back to particular community ends. Without calling out particular suburbs, my understanding is the further north you go, the further challenging becomes the infectivity rate and the lower the vaccination rate. So applying that geographically to Darebin, Moreland, Hume or Whittlesea, I think you get the same response.
And just given we were concentrating on suburbs in Hume or Wyndham instead of Darebin, and I guess suburbs on the northern end of Darebin have a very similar profile to Hume and Whittlesea, for example. Has that meant that we weren't targeting those suburbs quickly enough?
We've been targeting all of those areas, whether it be through state-run clinics, whether it be through insisting with the Commonwealth that as more GPs come online and as more pharmacies come online, those areas that are underrepresented in those two groups get first priority for those services, and I was pleased that the Commonwealth agreed with us on that. So all of those areas that are underrepresented are the key to, be that on vaccination levels and testing levels, they're the ones that have been prioritised. And we've seen the results. Wyndham, Hobson's Bay, areas in the west have now exceeded the state average.
With mandatory vaccination, we've put it in place for healthcare workers, aged care workers, construction workers. Why not disability when there's such a vulnerable cohort within that sector?
Well, I just cast your mind back to 1A and 1B that the Commonwealth launched way back in February and March. The Commonwealth took responsibility for the disability sector and did so willingly. I've seen reports how it was, relatively speaking, deprioritised over subsequent months in favour of residential aged care, and that's judgments that the Commonwealth made. The Victorian government supported the disability sector, even though it was notionally a focus of the Commonwealth, through at least 2 blitzes over recent months where we had quite strong support from both disability workers and people with disability. And we've also engaged disability access teams to work with the NDIS and group homes and people with disabilities to navigate the services for people with disabilities to be vaccinated. But we've done so because people with disabilities are Victorians, like everyone else, but we've done so in the knowing that that's primarily, well, more than primarily, it is the Commonwealth Government's responsibility.
So they'd have to be the ones to make the call about a mandate then? rather than us?
Yes, like they did for residential aged care. But having said all that, if the Victorian Government can assist within the constraints of what we're supplied, we have done so and we will continue to do so, because people with disabilities are disproportionately a vulnerable group. And I do note that that was pretty much what the Royal Commission into Disabilities report said just yesterday.
Just back on 000 calls. Sorry, go to your question.
Yes.
Is there anything explaining exactly what has driven that demand? And I guess, is there any evidence that it's been driven by people calling the police to dob on their neighbours for breaching restrictions?
I would certainly hope not. And not that I'm aware of, but I can certainly inquire as to what are the myriad of factors that might be driving that. But 000 is a life-saving service. And if people want to bring other politics or other non-medical or life-saving issues to 000's attention, now is not the time to do that. It is never a good time to do it, but now is a particularly bad time. So please, if that's the case, and I'm not saying it is, it should not happen.
Sorry, just really quickly, there was a convoy of truck drivers protesting mandated vaccines for drivers having to go into New South Wales. What's your reaction to seeing that? And can you just reiterate the new rules for those drivers?
Well, these are national rules that are applied to keep our important freight and logistic industries operating as the lifeblood of keeping shops full and food on our tables. The Victorian Government, through both testing and vaccination arrangements, is more than happy to deliver on that national plan, particularly noting that over the course of, since these various outbreaks commenced, we've seen multiple incursions through the freight industry. If there's challenges for the freight industry, individuals, drivers, then I'm sure we can work through those with the sector as we have, whether it's through testing, whether it's through vaccination centres. The logistics industry have been very sensible partners through the national agreements that are in place as to how to deal with keeping them open but keeping them safe.
Minister, New South Wales did almost 83,000 more tests than Victoria in the past 24 hours, and yet our cases are higher. Are you concerned that we're not getting an accurate picture of how many COVID cases are in the community, and how can you explain the much lower testing?
Oh, well, because the New South Wales Government have approached essentially testing as being a key part of how some groups of workers are required to leave areas of concern from their locations. There's also the fact that they're a bigger state, and there's also a fact that we are targeting those areas of highest concern for symptomatic and other testing. New South Wales has always had a different approach throughout the course of the pandemic. That's no reflection on New South Wales. I'm sure it's served them well, but we've all approached testing through different prisms. Having said that, could I take the opportunity to reinforce again, if anyone has even the slightest of symptoms, no matter where you are in Victoria, then you need to get tested. Everyone happy? Thanks for your time. We'll see you soon.